P23. Knowledge, access, power. P23. Wellness and understanding at your fingertips. P23. And that's no cap.
Welcome back to Demystifying DNA, your trusted source for making the complexities of genetics understandable, simple, and relevant to our health and lives. I'm your host and friend, Dr. Tiffany Montgomery, scientist and epidemiologist, and just that curious lady, joined by my co-host, Nick Cuevas. In today's episode, Exploring Genetics and GLP-1, Unveiling the connection between DNA and appetite suppression drugs, we're going to learn about how our genetic makeup affects the effectiveness of appetite suppression drugs. I'm so excited to have Nick join us again. Welcome, Nick.
Hi, doctor. How are you?
I am doing well, Nick. Thank you for joining us. I know that you are a health enthusiast and workout extraordinaire. Working out is just something that you're really good at and you're motivated by weight loss. I know that you've lost 100 pounds of your own. Is that correct?
Yes, I did. It wasn't easy. Learned a lot in that journey, but yes, I did lose a significant amount of weight, and I am a health enthusiast, I guess, but it's more about feeling good, not really looking good at this point.
So I have to ask, Nick, did you use GLP-1s?
That's a great question. No, when I did it, I didn't even know it existed. It wasn't the thing that it is today. I've heard about it. Don't know much about it other than what I see in the tabloids. Yeah, I mean, from what I'm hearing, it's an incredible drug. I just don't know a lot about it.
So I am going to enjoy talking to you tonight. But if you get 1,000 likes on this video, do you promise to come back and tell us how you lost 100 pounds?
Sure, I definitely will. I'll go in depth if we get 1,000 likes.
If we get 1,000 likes, you're going to go in depth on how you lost 100 pounds. This will be straight up, no chasers. You solemnly promise to tell the whole truth and nothing but the truth. So help you God.
Oh, right hand is raised. Facts. I will even do it again on camera.
Okay. So we're going to hold him to that. I'm going to really push this video, okay?
All right.
Because I want to know. So let me tell you all, I don't even know all of the things that Nick did. I might know just a couple because I'm always poking him, but he is very, I won't say secretive or private, but not about himself. He's all about everybody else and how everybody else is doing and feeling. And he's more into others than he is himself. So this will be fun if we could get into what's going on with Nick. I would love that episode. For this one, we will explore the fascinating world of GLP-1s and its interactions with our DNA and break down the scientific breakthroughs in a way that's accessible and easy to understand. We're here to simplify the science, uncovering how these discoveries are revolutionizing our approach to weight management and metabolic health. So join us today as we make the complex world of genetics easy to understand, starting with today's topic on the GLP-1 medications and the genetic factors influencing appetite suppression. Let's dive in. So, Nick, you told us that you don't know much about GLP-1.
Yep, I don't know much. I just know that some celebrities are known for using it. It's been like a secret in the industry for a little while, and it kind of popped off in the last year or two. And it sounds very interesting because a lot of people that I know are using it, but I don't really know much about it.
So I know recently in the news, Oprah Winfrey revealed that she was using GLP-1s to maintain her weight. So she was on the red carpet when they released the Color Purple musical here recently.
Mm-hmm.
And she looked incredible. So somebody asked her, I believe it was a reporter or something, I'm not really sure. But she was asked and she was honest and just came out and said, I've been using a GLP-1 weight loss drug, and that's my secret behind maintaining my weight loss. So with that, that's just one celebrity that I know has publicly said. A lot of people, we don't know like what they're doing. They won't tell us. They're like little Nicks in the making, you know. They won't say a word, but we are able to find out when they do disclose things like that. And it's been all the buzz. So for me, it was really important to help people understand what GLP-1s are and kind of what they stand for. And we'll kind of talk about it. And then if there are some questions or something that you want me to go back and clear up, I want you to just go ahead and interrupt me. And
I already got some.
oh, wow. How do you have questions and I haven't even told you what it is?
Well, is it GLP-1, is that like just a broad name of the drugs? There's different names for it? Or is that like a classification of the drug?
That's a great question. So that's a classification.
Okay.
So it is a drug class. GLP-1 stands for glucagon-like peptide 1, which is a hormone that helps regulate appetite and blood sugar levels. GLP-1 agonists are a class of drugs that mimic the effect of this hormone and then are used in turn to treat type 2 diabetes and obesity. So studies have found recently in the news that most weight loss drugs, including GLP-1 agonists, were linked to a lower likelihood of depression and anxiety diagnosis. There have been some studies recently with newer weight loss drugs that are GLP-1 agonists. So the ones that are more popular are the ones that Eli Lilly make, which are Wegovy and Ozempic. You hear a lot about that. They have been facing some supply shortages because so many people want those drugs. One of the other GLP-1s is a semaglutide. So as you're driving down the street, you may see signs that say, we can give you semaglutide, or we have a semaglutide compound for weight loss. Call this number. It's that popular now.
Yeah.
And it used to be years ago, you would see those signs for fen-phen before we kind of took fen-phen off the market.
Mm-hmm.
There's also a new GLP-1 agonist, AMG 133, that has showed some really promising results in a phase 1 clinical trial. And it's been demonstrating significant weight loss with favorable safety profiles. So it may even be a safer weight loss option. But as I stated, that's a phase 1 clinical trial. So usually clinical trials have to go through at least 3 phases before they're introduced to the mass public.
Okay. Very interesting. Do you have information on how long it's been around? Because I'm sure Oprah wasn't taking it like a year ago. Sounds like she's been taking it for quite a bit.
Well, GLP-1s have been used for weight loss for about the past 4 years, at least.
That's it?
At least. It's become popular, and you have to remember, they were originally used to treat type 2 diabetes. So as people were taking insulin and that kind of thing, so how long has that been around? It's from studying the effects of the drug that we start to think about other use and other purposes. Here, especially in the US, obesity has become a major problem, a major issue. Then you bring into like COVID and the whole, US population being under quarantine. It was almost like that freshman 15 magnified by, 5.
Mm-hmm.
So during the lockdown periods and during the periods of isolation and working from home and being remote, we used our bodies less. But guess what we did? We ate more. So whether it was DoorDash or Uber Eats or whatever it was, or maybe we're home and so we're cooking as we're working from the computer. These are things that have caused us to gain weight. Our children gain weight because they weren't doing recess and they weren't going out to school. Everybody's sitting at the computer all day long. So we compounded our obesity problem. And it was during that time that we developed the ability or the understanding or the correlation to link those diabetes related drugs to weight loss and the other things that they could do to help us. So with the GLP-1s, they're keeping that food in your belly longer. So you're eating, you're feeling full. We're activating those genes of fullness. Those signals of fullness are going to your brain. And then that food is moving slower through your body. So you're full for a longer period of time. You're not eating as much, which lowers your calorie intake so that you can burn more of those stored fats and calories that you have. Not only that, but it's become a safe way to wipe your appetite out.
Okay. So you're basically more satiated for a while, but let me ask you another question then. Since it's basically going through your digestive system slower, which I'm assuming that's why you're full for a longer period of time, is that necessarily good for you or bad for you since it's slowing that process? Is there any data yet back on that?
So there's a lot of data out and available. GLP-1 agonists are a type of medication that mimics the effect of a natural hormone called glucagon-like peptide 1. This hormone is naturally occurring. It's there. So what is happening is by taking this medicine, we're just increasing that amount of hormone that your body is recognizing. This helps regulate appetite and blood sugar levels by stimulating insulin production, suppressing glucagon release, and slowing down gastric emptying. So that's when we say your stomach feels fuller longer. So when we slow gastric emptying, it's going to slow that speed so that that food is not moving through as quick. That helps you because you're not trying to take in more food. You're not feeling like, oh, I'm still hungry, right?
Yeah.
By doing so, your GLP-1 agonist can lower those blood sugar levels, reduce food intake, and promote weight loss in people with type 2 diabetes and obesity. Now, there are side effects. The belief is that those side effects are reduced or minimal because we're simulating a natural hormone that is occurring in your body anyway.
Mm-hmm.
You talked about that satiety or feeling fuller longer. It is going to not only happen in your stomach, but also in your brain because it's a hormone. So as we're looking at what that entails or what that feels like for your body, it's a natural process that's already happening and it may help. Obesity is a complex condition and effective management might require several therapies. You might have a GLP-1. We always recommend dietary changes and exercise. There are behavior modification programs that you can participate in and also weight loss surgery. GLP-1s can be used in conjunction with any of these activities. And to have an effective weight loss program, it's going to have to entail many parts and many pieces. But I have a feeling, Nick, I'm preaching to the choir and you know more than you're telling me. So there are benefits and there are side effects. While I'm not a medical doctor, I am a research scientist. So I'm able to look at, understand, and help clinicians understand what those benefits and side effects are so that they can weigh them out individually for each patient. So for your benefits, you could have a lower blood pressure. You could improve if you have certain lipid disorders. You could improve fatty liver disease, reduce your risk of heart disease and kidney disease. and you could delay the progression of diabetes-related neuropathy, which is common in a lot of diabetics. There are side effects. So you asked me about the side effects.
This is what I want to know.
Some of the side effects we want, like loss of appetite. That's a side effect.
Of course.
Nausea, vomiting, diarrhea. Those might not be things that we enjoy, but you weigh out benefit versus risk. Other side effects could include dizziness, increased heart rate, infections, headaches, upset stomach, itchy skin. And then there are side effects that are more rare, but also more severe. And those include pancreatitis, medullary thyroid cancer, sudden kidney injury, and a worsening of diabetes-related retinopathy. So if you already have diabetes, the inability to see or changes in your vision is what that is.
Wow.
Now, those are rare, but those are side effects that studies have shown and disclosed are possible when taking GLP-1s.
Sounds like one of those commercials that we used to see that would give you like a 30-second monologue on all the things that you could get while taking the prescription to something. Well, obviously people are, those side effects aren't really on the plateau for them because it's like one of the most popular things out right now. I mean, you hear about it everywhere right now, especially in the entertainment industry, influencers, people on social media, they swear by it. Do you think, well, first I want to know, how does it tie into DNA and genetics? Because that I had no idea about.
So great question. But the first thing we had to talk about and establish is what it is. Now let's get to the fun stuff.
Yeah.
So we talked about GLP-1s, and they are receptor agonists, which are a class of medications primarily used in the management of type 2 diabetes and obesity. They work by mimicking the action of a GLP-1, a hormone that helps regulate blood sugar levels and appetite. While these medications are known to aid in weight loss, the extent of weight loss and individual responses vary based on genetic factors. Genetics play a significant role in how individuals respond to medications, including GLP-1 receptor agonists. Several genetic variations can influence drug metabolism, efficacy, and adverse reactions. Some studies have even explored the relationship between genetic factors and your individual response to GLP-1 receptor agonists in terms of weight loss and glycemic control. For example, variations in genes related to GLP-1 pathways, such as genes encoding for the GLP-1 receptors or enzymes involved in GLP-1 metabolism, could impact individuals' response to these medications. Additionally, genetic factors related to appetite regulation, metabolism, and insulin sensitivity may influence the effectiveness of the GLP-1 receptor agonist for weight loss. But you have to remember, Nick, and we've been saying this repeatedly, it's a layered thing. It's a layered approach. So we have to note, and we have to just highlight for everybody, genetics can provide insights to how you respond to the medication, but it's just one piece of the puzzle. Other factors such as lifestyle, diet, physical activity level, overall health also play a significant role in determining the effectiveness of weight loss interventions, including your GLP-1 receptor agonist. It has to be a layered approach, and personalized medicine is going to take into account those genetic factors along with individual characteristics that can help optimize treatment outcomes for patients prescribed those medications.
My question to you is, with the GLP-1 drug, let's just say, hypothetically speaking, you invented that drug or that medication. and you already invented a genetic test that would kind of correlate or marry with that drug. Do you think that there should be genetic testing prior to getting put on that medication? And how would that benefit the client or the patient? So if I went into a clinic and, I think that I would need this, or I would talk to my primary physician and they suggest that I should, or they recommend that I do it because I have type 2 or whatnot. Do you think, or do you know if there is any genetic tests that you can marry into that to where it can kind of help you know more information on GLP-1 working on you efficiently?
Absolutely. So at P23, because I have to talk first about P23, that's what I know. And there are other labs as well. But P23 offers a pharmacogenomics test. The nickname is called PGX. So it's really popular and it helps to understand those genes and those metabolic pathways, what's turned on, what's turned off. Not all GLP-1s are the same, nor are they created equally. We've talked about semaglutide. We've talked about Ozempic. We've talked briefly about Wegovy. We've talked about a new weight loss drug that's a GLP-1 under stage 1 clinical trial, which is AMG 133. There are going to be different pathways that each of these drugs use. It's manipulating a hormone, and the receptors of the hormone, it's mimicking something that's happening in your body. And it's like your math teacher asking you, give me 5 ways to generate the answer being a number 4. Well, you could do 1 plus 3, you could do 3 plus 1, you could do 2 plus 2, you could do 1 times 4. There are so many ways that you can get to the number 4. So if the goal is to get to the mimicking of this GLP-1 agonist naturally occurring in your body, different drug manufacturers will take different ways to answer that question. What we know is that we're able to look at your genes and the pathways that they're using, because they'll tell us as scientists if they're taking 1 plus 3, if they're taking 2 plus 2, if they're taking 1 times 4. And we will be able to say, genetically, based on this person's personalized medical report, they would benefit most from a 3 plus 1 approach to getting to 4 because of how the pathway works and how quickly your body will open and close or process that pathway. There are several genes that can influence an individual's GLP-1 drug response. And those key genes that we look at P23 are the GLP-1R, which is a gene that encodes for GLP-1 receptor. That's the primary target of a GLP-1 drug. Variations in this drug could impact the receptor's function or expression level, affecting how effectively a GLP-1 drug can bind and exert their effects. There's ADRA2A. This gene encodes a receptor involved in regulating norepinephrine release. Variance in this gene has been associated with different appetite regulation and response to GLP-1 agonists. We've got MC4R, FTO, which is one of my favorite ones. This is a fat mass and obesity associated protein. So variants in the FTO gene have been associated with obesity risk and may impact the response to weight loss interventions, including GLP-1 drugs. There are 2 others, ADCY3 and GIPR. So those are the 2 additional key receptors that we look at. GIPR, which is gastric inhibitory polypeptide receptor. Although GLP-1 drugs primarily target GLP receptors, crosstalk between GLP-1 and other gut hormones, such as gastric inhibitory polypeptide or GIP, may influence their effects. So genetic variations in the GIPR could potentially affect the response of GLP-1 drugs. We're looking at, depending on which GLP-1 you're using, is there crosstalk? Is your body more prone to this type of crosstalk? Will you have maybe resulting in your nausea or diarrhea or your other gastric, upset issues? Some people will take a GLP-1 and they'll have really bad nausea, vomit, and diarrhea. Other people will take it and their body is able to adjust and they'll be just fine with it. So those are the types of things that we look at. Now, could you live and function with nausea, vomit, and diarrhea? Absolutely. Is it worth it to lose weight? It depends on who you ask. Some people say absolutely. If your answer is absolutely to both of them, but you know that there's a test that could help you reduce that and avoid the risk of having the nausea, vomiting, and diarrhea, would you be prone to take that test? Those are the types of questions that you have to ask yourself when you really dig into what's going on here. And these are just a few examples. These are the main variants or gene variants that P23 looks at when we're trying to assess your response to GLP-1 drugs. Now, PGX testing is not restricted to just GLP-1 drugs. There's a lot of valuable information for pain management, psych medication management. We can help with the drugs that you're needing the most to impact your healthcare, including cardiovascular drugs, of course, diabetes drugs. But if you're looking at weight loss drugs, our test even has a section in it about oral contraception or birth control. So if you even want to know which birth control pills might work better for you and give you the least amount of side effects while achieving that optimal result, these are things that can be answered with the simple PGX test. And unfortunately, it is not something that a lot of insurance companies will cover. They require a lot of what we call medical necessities or reasons as to why. Our insurance companies in the US are more reactive instead of proactive. If you have a cancer or you have a problem, they will approve that testing for you. Let's say you're having adverse drug reactions to a drug and you've tried 3 or 4 and every one is not working. They will then approve it. They will not proactively do it and say, this person is considering taking a drug. This person has a family history of psychosis. This person has a family history of cardiology or cardiac events. How can we help this person manage these conditions if they happen? There's no approval process for that. In comes P23. And while we've introduced more of a cash pay, proactive, you take control of your health, we're helping you with the coaching and deciding, which tests you're needing. We're looking at what will benefit you and how you use that information once you get it to try to impact your outcome in a different way. We believe in a proactive approach because it works. It gives you a healthier quality of life. That's not where we are as a country, but it's why we always say it's time to revolutionize healthcare, because there are some changes that need to happen. And the more informed we are, the more we can demand and ask and say, hey, we're paying premiums for this insurance. We're paying out of our pocket every month. Nobody wants to pay when they're sick. Help us stay healthy. If we come together and collectively make that our voice and say, insurance company, help us stay healthy, or we're going to cancel our insurance, we're not going to pay our premiums, I think we'll see some changes, some serious changes being made in the healthcare system. But it takes education of knowing what's out there. It takes a collective. It takes multiple people saying it, not just one person saying it. And it has to be something that we're all committed to.
You said a lot. There's 1,000 things to unpack. One thing that stuck with me was the last couple of things you said about how the whole process is about being proactive and reactive. And then as well, I had a question regarding those genetic tests, the PGX tests or any other test that another company has. When they're giving this drug out to people, for whatever reason, it's more like a one size fits all. And if they did do the genetic testing prior, they could have a more tailored drug for that person that would benefit them tremendously more. So what I'm asking you is there a reason why they don't have that included? Like, hey, all right, you want to take this? Well, let me first do this test first so I could figure out which one of these GLP-1 drugs would work for you better, instead of them kind of doing a one size fits all type thing.
Well, you said a lot and you don't even know you said a lot. That's a difficult question to unpack. I'll start off by saying Most laboratories, especially if they're not cash pay, and most of the labs are not just cash pay, they're still heavily accepting insurance and that kind of thing. The first thing that they want to do is make sure that they are going to be paid or reimbursed for any test that they give you. GLP-1 proteins or GLP-1 genes are not even in most PGX assays because they're not reimbursable. This is not something the insurance company is going to pay for. Most labs are going to give you exactly what it is the insurance company paid for and limit what you see to what the doctor is saying you need it. So this is a different approach. Most labs are not going to even have this in because it's just a temporary inconvenience. So nausea, vomiting, diarrhea, although we don't like to do them, nobody wants to have these things happen. They're very temporary. Mm-hmm. By the time your stomach gets used to the drug, your body is used to taking it, these side effects could level out, or we could switch you, or we could reduce the dose. There are other things that we could do that are not as costly as this genetic test that could help you understand how to take that drug or manage the symptoms or live with it. You could get diarrhea and just say, I'm going to take Imodium AD. So you take another drug to stop the effects of that drug. There's not a collective outcry from people to say, or even enough people who understand we don't have to go through these things. So raising awareness and having these conversations and making sure people understand are going to be key for us. The purpose we want to make sure people understand is that the interplay between genetics and the response to GLP-1 drugs is complex and multifactorial. Further research is needed to elucidate the role of genetics in individual responses to these medications. Additionally, genetic testing and personalized medicine approaches may optimize treatment outcomes by identifying individuals who are most likely to benefit from GLP-1 drugs. So we talked earlier about the shortages on the Eli Lilly drugs for Wegovy and Ozempic. If we were offering this test to people before taking the drug, we may not have a drug shortage because we may be able to identify, we don't even have to write these for you because these are not going to work for you.
Yep.
And we haven't interviewed enough people, but I bet you once we look at the comments for our episodes, we'll see people telling us, hey, I took a GLP-1 and it didn't work for me. Did I take the wrong one or which one did I need to take? In comes P23. You may take a semaglutide compound, which is not Wegovy. It's a compound. It's like an off-brand almost. And it didn't work for you, so you think GLP-1s are bad. But not all GLP-1s are created equally. Not all of them follow the same pathway. Not all of them will give your body the same side effects. So if you take one and it doesn't work, that does not eliminate all. And if you take one and it does work, let's say you've been taking Ozempic and there's now a shortage. And so your doctor says, I'm going to write you for semaglutide or whatever. And that one doesn't work. It doesn't mean that it stopped working for you. It means that your body only responds to Ozempic, or you get the best response from Ozempic in that example. Now, I'm not endorsing any of them. It's a personal journey. You need to look at what's going to work for you, but we have to have those conversations.
It sounds like it's more costly in the long run, because I know the insurance companies, they just want to cut costs. They want to be as profitable as possible. And that's a whole nother podcast in itself. But what I'm saying is, since they're doing it that way, they're kind of just slapping you with whatever drug it is that they have on in stock, basically. But wouldn't it be in the long run, mathematically, most likely it would work out better? It would be more cost efficient? Or do you think that kind of falls into the cycle of the healthcare industry or business? Let's be real.
Well, Nick, I think we're going to have to save that question for another podcast. It's interesting. And, Dr. T does not want to upset any insurance companies, but we need to have some honest conversations. We'll table that. And I promise you, we'll come back, you and I, and we'll delve into the cost or the potential cost savings of genetic testing, early testing, and how this could impact or improve insurance's bottom line.
Mm-hmm. Mm-hmm.
because it's all based on your DNA. We're going into a level where things are personal. Healthcare is personal. The more we learn about our bodies, the more we learn about genetics, the more control we have over making things incredibly personal. Imagine your body is like a house with lots of different rooms. Each room has a special job to do, like a kitchen for cooking or a bedroom for sleeping. Now, in your body, there are tiny parts called genes. Genes are like instructions that tell your body how to work. Some genes are like bosses that help you decide how to grow, how you look, how healthy you are. When we talk about GLP-1 drugs, we're talking about special medicine that helps your body control sugar and helps you feel less hungry. But not everybody's body is the same. Just like not all houses are built the same way. So some people have genes that make them respond better to this special medicine. These genes help medicine work better, like having a superpower to fight off bad guys. Other people might have genes that make the medicine work not as well, like having a weaker superpower. I know with Superman, he has super strength, but he has a kryptonite.
Mm-hmm.
So it might be something that acts as your kryptonite. These special genes can affect things like how much weight you might lose or how well your body can control sugar when you take this medicine. As scientists, we are still learning about these genes and how they work with the medicine so they can help people have better results from this medication. Remember, just like everyone's house is different, everybody's body is different too. And understanding how our genes work with medicine can help us stay healthy and strong. Well, it's time to wrap it up, Nick. We've been going a while. As we conclude another insightful episode of Demystifying DNA, exploring genetics and GLP-1, unveiling the connection between DNA and appetite suppression drugs, both Nick and I, Dr. Tiffany Montgomery, want to express our sincere thanks for embarking on this journey with us. Today, we peeled back the layers of the genetic foundations of appetite control and the promising future of GLP-1 related treatments. We've navigated through the forefront of genetic research, making it understandable and showing its vital role in battling obesity and enhancing metabolic health. Our mission is to illuminate the path of genetics in a way that sparks your curiosity and makes the complexity of this field accessible to everyone. We hope we've shed light on the synergy between our DNA and innovative medical advancements, inspiring you to delve deeper into the exciting possibilities that personalized medicine and metabolic health hold. Stay curious, keep engaged, and join us again on Demystifying DNA as we continue our quest to make the science of genetics easy to understand for all. Together, we're exploring the future of health and science, simplifying the intricate nature of DNA to empower you on your knowledge journey. We are with you every step of the way.
P23 Knowledge, Access, Power. P23 Wellness and Understanding at your fingertips. P23 And that's no cap.